How's it going, friends? My name is Jesse. Welcome to Male Nurse Mentor. You guys saw the title. We're doing a Q&A today. I posted 2 posts, reached out on Instagram. I got a couple questions. I like to do these every once in a while. That way it gives you guys an opportunity to ask me any questions. But apart from these Q&As, one way you can reach me, just to remind you all, Instagram, sending me a DM. But sending me a DM on Instagram is probably the best way to reach me for now. I'm working on some things behind the scenes, trying to do something with this Male Nurse Mentor brand. Just to give you a little sneak peek, it's gonna be a website. I'm working on an ebook, but I'm gonna continue to be here, creating this group here for male nurses or just people in general, right? I notice on YouTube, there's not a lot of people pushing out the motivation to go and become an RN. I wanna do that for you guys, especially for the men out there, just contemplating, dancing with this idea of, is it worth it? 100%, friends. 100% it is worth it. The time invested, the energy is worth the return of what you get in the lifestyle of being an RN. But enough with that stuff out the way. I got the Q&A and I got my phone here. We're gonna go through it and it's gonna go one question at a time. I'm gonna answer these in real time, raw answer. Let's go. I got a UC Davis mug here. I wish it was coffee, it's not. It's like 6 something in the morning. I try not to drink coffee this early. And that's my girl's mug. I didn't go to Davis. Davis doesn't have a nursing program. I went to Chico State alumni. And before that, community college. I was a community college alumni. And of course, friends, I got the beanie on. You know, if you've been here, I mentioned it before. Typically when I wear the beanie, it's chill. It's a relaxed video. We go at the pace we go. And yeah, we go at the pace we go. So the first question here is from Augustin. I know you submitted a couple of them, man, so we'll go through them just one at a time, and as they pop up, I'm gonna show the question on the screen here, and we'll go through them here. I know you put a couple, but I wanna get yours. I appreciate all your questions. I appreciate anybody who submitted questions. So, what do the staff break rooms look like in corrections and in other places? You did clinicals. Are you able to access your phone during break? What happens if your family needs to contact you during your shift or you don't have your phone? So you said in other places that I've done clinicals, not corrections. Well, the break room, you do get access to your phone anywhere else, right? It's like a standard break room. You get access to your phone, people are on their phone, eating, taking a break. As a nurse, very rarely do you get to actually enjoy that break because you're probably so tired from your 12-hour shift. But the little break that you do have, you do get your phone, you can scroll through it, you can make phone calls. You could break free during your day and go to the break room and make a quick call if you have to in normal nursing. In correctional nursing, you don't get access to your cell phone, not even in the break room. The cell phone stays outside in your car, which is gonna be a big change. You don't get to bring it in. You don't have any cell phone. You don't have any outside access directly to you when you're inside the prison. You do have access to a land phone, right? A landline, which is inside the prison. You can use those phones. You probably will have a phone at your desk as a nurse, and oftentimes they can call to the outside. Not every phone gets to call to the outside, but I believe, at least from my experience, any phone I had as a nurse, it was able to reach outside just in case you need to call 911 and stuff like that. There are certain phones though, like I was saying, that don't have access to the outside. Oftentimes these may be phones near the officers, which are then near the inmates and things like that. You don't want an inmate to pick up a phone and call, so-and-so out there on the streets. So oftentimes in the medical side of things, you're gonna have a phone, landline, you can call outside, no problem. But you can't bring in your cell phone, no. And as far as that last little piece, if your family needs to contact you, they'll be able to reach you. After you've been there for a little bit, you'll know what phone is by your desk and you can give your family that phone number. So this next question here is by Junior for God 11. I just really appreciate this content as a young man. Just want to know how easy of a transition it can be to become an RN in the US as a foreigner. What's the minimum experience one may need? Currently just waiting to get accepted to do my BSc. So if I'm not mistaken, is BSc from Canada? I may be wrong, but otherwise, I hear you're a foreigner trying to come in. So the main thing is, I haven't walked this path myself, but from what I've heard speaking to other people who have been foreigners coming here, right, to the US, trying to work as an RN, is it does involve having to take the NCLEX again. The Board of Nursing Work with them. They'll list all the requirements on that website for a foreigner coming in. If you previously worked as an RN, go to that website. It'll tell you what you need to know. And oftentimes it's just meeting the core standard requirements. So probably having completed a nursing degree and having had taken certain classes, right? Like anatomy, physiology, microbiology, like pediatrics, psych nursing, all these classes that are technically prereqs to get into a program, and oftentimes classes that are within the RN program itself. So if you've walked that path in another country, there's a high chance that it can translate over. You might have to send your transcripts and things like that. But ultimately, once you do all that paperwork stuff and confirm you have all the classes and your degree transfers over, like it's legitimate, then it's a matter of taking the NCLEX one more time. So once you take the NCLEX one more time, you get licensed in whatever state you take it in, and you're kind of good to go. So check out that website if you're curious. I didn't walk that path myself, so I don't know the specifics. So here we go, Augustine, I got you, man. I think I have a good one. Question: what type of surgeries are or can be performed in a prison hospital? I see a listing for corrections LPN and it says specialty is surgery. I didn't realize they did surgery in the jails, prisons. Maybe I am misunderstanding the listing. Just from my experience working in the county jail didn't really do any major surgeries. And even in the prison, they don't do any major surgeries. They do little minor procedures. Oftentimes it could be like putting on a cast for somebody, doing a small incision where you take something out and it requires like a small suture of some sort. Typically the doctors will do that, removing toenails, taking like a skin biopsy. But yeah, typically, I guess what I've seen is things that require small sutures, like an IND, incision and drainage, like, an abscess that's underneath the skin. They'll lance it and they'll kind of squeeze out what they can and then they'll pack it. So I'm just trying to think back, but nothing really significant. So it might be some type of surgical line that's, pretty basic, pretty minimal, quick outpatient stuff that takes maybe like a few hours at max, but the guy wouldn't be sedated or anything like that. They don't do sedation in the county jail or the prisons, at least that I've worked at. It just depends, but hopefully that gives you at least a decent picture. There's nothing major, there's no major surgeries that happen down in those settings. They typically will refer those out and work with the outside specialists to get any of those things done. So let's see this one. So I got Junior for God 11 again. So I appreciate these questions, guys. I know it's mainly been YouTube, but I appreciate these questions. And again, I want to encourage anybody, whenever I put these Q&As out here, ask me questions. Or if you just want to ask me on a more personal level, Instagram. Reach out to me on Instagram. A lot of you guys have reached out already, and I encourage it. I've even had a couple video calls with a couple people already. So quite a bit of people actually. So definitely reach out. If I can help you in any way, I'd love to do that. So this question says, since I'm the first, let me ask, what advice can you give in hindsight now that you've been through school and an RN for years to someone who will be doing their nursing degree soon? So I would say the most important thing is at the beginning, you're gonna realize how overwhelming it is, right? To do all the research and find the classes, find the programs, like everything's gonna be very overwhelming, right, to start. So for someone at the very beginning, right, of the journey of deciding to be an RN, like you finally got over the part where you've decided, right, hey, I'm gonna go for my RN, I'm gonna do it. From that point on, it can be very overwhelming. So what I recommend is sitting with yourself and really coming up with a blueprint, right? Do you wanna go the BSN route or the ADN route? What's your age? What's your financial support look like? Like, what's your time horizon look like? You're gonna wanna figure out all these things in a blueprint. This is a thing I can really help you guys with the most. So if you guys need any help with that part, I got you. But I would say having a blueprint is the most important piece. I'll give myself as an example, right? When I finally decided I was gonna be an RN, I had to kind of come up with my blueprint. I didn't know that's what it was at the time, but that's what it was. And I saw other people kind of struggling with their blueprints because they didn't really have one. They were just going in circles the whole time. So for me, I knew I wanted to get my BSN. That was like the mountain goal. And you take it one step at a time. So the first big goal was to get my BSN. How was I gonna do that? Well, for me, I decided to go to a community college to do my prereqs. And whenever I was actually signing up for my prereqs, I knew I had to get the best possible grade. I had to set up my semesters to get the best possible grade, taking maybe one hard class and 2 or 3 easier classes in each semester, and not really bombarding myself with a very heavy unit semester. So maybe 13 max, 14 max, right? And every semester I would do that. And then every summer I'd take one class as well. It took me about 2.5 years, but that's like the blueprint that I set at the very beginning. And then once I was really getting close to the end, I set myself up to take my TEAS test. So that was part of the blueprint as well. I ultimately took my TEAS test like 3 times. So don't get discouraged if the first time you go to take it, it's not the score that you want, right? Retake it again if you have to. And then look at these schools and what they're asking for on this journey, right? And throw them into your blueprint. If one of them is taking a Spanish class, right, to get an extra point, you do that. If one of them is becoming a CNA to get an extra point, you do that. But you have to start from the very beginning, see where it is you're going, and then put the things on the map in between and just start knocking it out, right? Lay out all your semesters, semester 1, semester 2, and so on, as you're knocking out your prereqs. But that is what I would say would be the blueprint, right? Would be the most important piece, is that blueprint. Just to be honest with you guys. But that's a great question for sure. And this next question here is Augustine. Oh, also, if you haven't spoken about it, what are the patient ratios and what type of care is done in the correction infirmary? So yes, in the correctional setting, you found the infirmary, right? That's one spot. They got the mini ER, the outpatient clinic, they got the infirmary. The infirmary, it's gonna be a lot of SNF-like type of work. You know, it's gonna be a lot of older patients who need assistance with ADLs, right? Bathing, eating, cleaning themselves, right? Getting up out of bed, back into bed, things like that. It's also gonna be a lot of wound care, right? Sometimes guys in there have pressure sores or just some general wound care because they're older and they can't really do it on their own, out in GP, out in their cell by themselves. Also, you're gonna see post-op patients, right? Or people who've come back from certain procedures. Again, it's like wound care and things like that. Medication pass is a big one in that setting. You're gonna pass out all the meds for these guys because they're technically inpatient in this infirmary. But apart from that, it's gonna be a lot of just those things. Handing out food trays, just keeping an eye on them, making sure they don't fall from bed, you know, lower the bed, rails up, and then just answering technically call lights. So, you know, they may call you for assistance in reaching for something or something like that, you know. So a lot of SNF type work is what I think of when I think of infirmaries. Sometimes when it comes to medications, they do have IV meds. So typically, you know, that's part of the medication pass as well. But think of SNF work, think of, you know, CNA, helping with ADLs, and then medication pass type work. That is the best way I think I could explain it. That's the medical side of the infirmary. In these infirmaries, they do have psych patients as well. So think of, you know, looking at patients on suicide watch and things like that, right? A lot of observation. And these guys aren't really medical. A lot of them are psych. Some of them can have medical needs, but it's like a whole different type of work, you know? So they give you kind of both patients at the same time, at least in the California State prison system. And this next question here by Augustine. How long does it generally take to get from your car to your workstation area in the corrections? So this is a good question. You know, we joke around, you know, my colleagues and I would joke around, but it like legit takes like 10 minutes just to go from your car, you know, up to your desk. And that may not seem like a lot, but the amount of doors and the distance that you have to get through, it's like a mile. So it takes 10 minutes, but it's literally like a mile. You have to go through door after door after door. Some of them are automated. Some of them you have to go through a guard check. Sometimes you have to go and pull your keys if you have keys. And it just takes a long time. There's a lot of locks. The distance is like a mile. So, you know, I'm just picturing it now, but yeah, it's far. It's far. It takes like 10 minutes to get to your desk. And it's because it's literally like a mile walk through multiple doors. So that's just the prison. Just how it goes. It might even be close to 15 minutes. So 10 to 15 minutes. It depends how quick you walk. So this next question by Augustine. How flexible is corrections nursing work schedule? My buddy worked as a psych tech through RN school and had to work 19 hours a week to keep his benefits. I'm interested in doing something similar. So, you know, it's hit or miss. It depends like what you're looking for in terms of flexibility. I know if someone's working full time in the California State prison system, you know, you can flex your hours. You can find a swap partner is what they call it. And you can work a 16-hour shift, a 16-hour shift, and then an 8-hour shift. That right there would technically be your 40 hours for the week. And you can work your schedule that way, full time. I believe they also have part-time gigs. You know, we don't really see too many part-time workers, but I've seen them posted on CalCareers, for example, and you could work part-time. I don't know the exact hour amount, maybe 24 hours or something like that, I would think, for the week. But you could be part-time, maybe it's 30 hours or something. But look into that if that's something you're curious about. I believe if you do work part-time, you still get benefits as a state worker. But in terms of it being flexible, you can also do a contract. That's probably a lot more flexible, working for the prison system or the county jail. You kind of just pick up shifts when you want, I would imagine. And that's probably the closest thing to being a per diem. So I would say working with the contractor in that setting is probably your best bet. So I got this next question by Zenny Oyt. I think if I remember, I think you were one of my first questions on one of my first Q&As. So cool to see you again here. But good question. Is it worth it to start as a CNA first? I heard that CNAs get mistreated the most, in some cases not allowed the same amount of breaks as RNs. I want to get started as soon as possible, but I don't want to sign up for workplace abuse. I got a couple points on this. I think first and foremost, is it worth it to become a CNA? Just to be blunt, I would say, especially if your goal is to become an RN, you don't have to, right? And I would just say no, just to be blunt. And the reason why is because I know as an RN, you don't have to be a CNA first. I would only do the CNA if you're lacking experience. And let me take that back. If you're lacking points on your application and you need experience, or you have time to kill, or you can't really enter any programs or schooling to become an RN or LVN. So you're just trying to get in healthcare and get experience. The easiest point of entry is becoming a CNA. So I would do it because of that, right? If you're just trying to get your foot in, trying to figure out if healthcare is for you. But I would still throw in a caveat into that with the idea that CNA work isn't RN work. So you do got to be careful. If you go to become a CNA and you really don't like it, just understand that CNA work isn't RN work. RN work is different. And you mentioned something here as well about, CNAs getting mistreated the most. And this kind of ties into, because it is the easiest point of entry, right, into healthcare in a way, becoming a CNA, is you're technically at the bottom of the chain. CNAs are at the very bottom. It's probably one of the most basic jobs. It's very backbreaking, but you do get good experience being hands-on with patients. And as an RN, I love CNAs. But sure, you can say that they do get mistreated because they're at the bottom of the chain. But I would say to that, if someone's an asshole, they're gonna be an asshole to you, whether you're a CNA or a doctor. It doesn't really matter, that person's being an asshole. But to say they don't get mistreated, they can, because you guys are kind of at the bottom of the chain, and people can have less respect for you in a way. But again, I would say those people are probably assholes. So take it with a grain of salt. But I would say, just in summary, it's not worth it if your ultimate goal is to become an RN. I would say it's worth it if you need more experience for your application, right? To get a better score for your application. You're trying to fluff it up, right? You're trying to find something to do to give yourself a better chance to get in. And you're just trying to get experience in the healthcare field, because you can't really start an LVN program yet, or you can't start an RN program, but you kind of want to get experience and get a taste of healthcare, then that's a good way to do it. For me, just to give you a little background, some of you guys may know already, I didn't get into the first time I applied to my RN programs, so I try to find ways to really increase my application, give myself a better chance. I took Spanish over the summer, and then at that same time, I was also in a CNA program, because I was already switching my mindset to work as a CNA, get experience, puff up my application, so that way I have a higher score on my application and better chance of getting in. So I went through the whole CNA program, but I didn't actually work as a CNA, because luckily for me, I actually got in the second round that I applied. But I was ready, I was willing and ready to do it. I was gonna sacrifice and do that. But that's when I found out, it's tough work, it's very laborious, and I would just say it's not worth it if you don't have to do it. And just to throw it out there, most RNs that I've seen didn't start out as CNAs. The amount of nurses that have been CNAs is a lot smaller than the opposite of that. So most nurses haven't been CNAs. Semester 1 in your RN program is gonna be all CNA type work for your clinical hours. So let's say you've done CNA work and you go into first semester, you're gonna be ahead of the curve. I felt ahead of the curve, but everyone who doesn't have experience, they bring you up to speed. So that's why I say it doesn't really matter if you have CNA experience or not. But yeah, be careful with the workplace abuse. That is not normal. Don't accept that. Definitely report that if that's the case. It's not normal to be abused at work, never. This next question is point of view 9090. Hi buddy, how we manage stress. I watched your recent video, but again, the hypocrisy of getting an A and finals are coming up next week. What I can do, semester 1 student, having OSPE, OSCE, and so much other stuff to prepare. 50 students in class, 25 are female. You know, female students have high EQ, it's all getting worse. So first off, I would say that's a good question. I know there's a lot in there. You know, first thing that stood out to me is this IQ thing. You know, I think it goes across the board, male or female. I think anybody has high IQ. You know, I don't say that to discredit you, but it's just a mindset shift, right? I hear you're stressed out about your current situation, especially with these tests coming up and getting an A and passing. I would say the biggest thing with that is if that's the point that's giving you the most stress right now, right, which is all this school stuff, a lot of it is going to be preparation, right? A lot of it is anticipation of what's going to happen. So that's giving you a lot of anxiety, right? Of the score you're going to get. Are you going to pass? How other people are doing? Are they going to do better than me? Other people seem to be doing just fine. I think what you realize, or maybe don't realize, is a lot of people are stressed out with you. You're probably not the only one. It sounds like these are really big tests. So it's normal to be stressed about it. So I hear you're stressed. So just know that it's normal. It's normal to be stressed. And the best way to manage it is going to be preparation. You know, it's okay to be stressed about something. But when you get the time, right, and the energy, take time to prepare as best as you can, and then just live with the outcome. It's okay if you don't get the score that you want. It's not going to be the entire end of it all, right? You'll get another chance. You know, for me, I just think back to all the times I was stressing out about getting into nursing school the first time and I didn't get in, right? There's another opportunity, and then I reapplied and I got in that time. I remember I stressed out a lot about the TEAS test. I tried to take it once and I got a certain score. The score wasn't good enough and I had to retake it again. Again, it wasn't the score that I wanted, so I had to retake it again. And then I remember my classes, right? Trying to get A's in my classes. That's very stressful because you spend a whole semester trying to get this grade, and if you don't get it, you're like, man, I gotta do it all over again. But a lot of it is just preparation, you know, preparing yourself the best that you possibly can, and give yourself a lot of grace. If you're so choked up on this pressure, it's gonna be hard to perform. One way is just give yourself grace, alleviate some of that pressure from the beginning. Understand that, you know, even if it doesn't happen this time, there's gonna be another time where you can do it. And just know you're probably not the only one stressing about this thing. There's gonna be everybody else probably stressing about this thing with you, right? It sounds like these are some big tests. I personally didn't have to take these, but a lot of it is preparation, and a lot of it is just allowing yourself to be stressed. It's normal to be stressed. There's nothing you have to fight within yourself to just not be stressed. It's okay. Allow me to tell you it's all right. It's all right to be stressed. Now it's just a matter of what we do with that stress. You got this. So it looks like that's gonna be it, friends. That's gonna be it for this Q&A. I appreciate all your guys' questions. If you guys have any questions, any new ones, you can leave them down in the comments down below. I'll use those, pull those whenever I do my next Q&A, or just leave a comment down below. I might be able to answer it for you in real time. But again, the best way to reach out to me is Male Nurse Mentor on Instagram. Send me a DM. I'm gonna continue to be here. I've already gotten to a place in my career where I can say I can look back and be proud of where I've gotten. You know, I've went through the whole bedside phase, and now looking at where I'm currently at, I don't see myself going back to bedside. And this is about 5, almost 6 years into my nursing career. I've gone to a place where I'm not gonna go bedside anymore. I work as a nurse consultant as an entry level for the state of California, and it's only up from here. But I know the journey that you have to take to get here. I don't forget that, and especially the journey to even become a nurse in the first place. I haven't forgot that. So I'm here with you guys, friends. Still working full time, still as a nurse, still remembering that whole journey. If you need any help, any encouragement, any motivation, inspiration, I got you. Don't hesitate, reach out to me. I'll see you guys on the next one.